My work is deeply grounded and situated in addressing anti-Black racism, but I absolutely am committed to not doing that work at the expense of our Indigenous communities. That it's really important that we understand anti-Indigeneity first and foremost as the work that we're doing, and then within that, I look at anti-Black racism as it's experienced by Black communities in Canada. So the theme of my lab is bringing the alarm on Black health disparities and working with Black communities for change. It's really important for me, and this has come from my work experience at Women's Health and Women's Hands, where we would see enormous health differences in the experiences that Black women in particular were having in relationship to HIV. But no one was really sounding an alarm in terms of, yes, we collect this data, but how are we letting communities know about their risk? How are we letting communities know about the changes that we need to engage in, and not really engaging with communities to develop adequate solutions? And so that became the theme of how I work and how I set up my research. To begin with, I have to also think about decolonizing the space of research. And my lab is, yes, about conducting research, particularly in the field of HIV, but I also want to ensure that my lab is a low barrier lab. And the goal is to also allow Black community members to engage in research at students at all levels from the beginning. I'm trying to reach down into high school now, but from the undergraduate level all the way up to postdoc. And when I say low barrier, what I take a look at are what are some of the things that prevent students from engaging in research and being a part of a research lab in an academic institution. Sometimes students have to work, and so I ensure that all the students that are in the lab are in paid positions. I don't ask for transcripts. I don't look at transcripts of students to qualify to be in the lab, and they also do not require having any previous research experience. The interview is really asking students about their commitment to working with Black communities, what is their interest in research in general, and what are their future goals, because we want to make sure that if you're entering the lab, that we're going to enable you and support you to reach what your future academic goals are. So part of mentorship for me is also creating spaces that I call low barrier, that I understand that only 1.9% of all academic faculty in Canada are Black. So when we're talking about who is even in academic positions to engage in HIV research, you're drawing from a pool from the Black community that's only 1.9% of all faculty. That's a very small pool. So part of my work and ambition is to increase that pool. And the way that you increase that pool, obviously, is to provide Black students with opportunities to engage in research from the beginning of their academic career. Right now, the lab is 2 years old. We are just today reached 20 students that are in the lab. My first postdoc just finished and took a teaching position at Dalhousie, which I'm really excited about. So this is just a sense of some of the students that are in the lab. What we know for sure, what we absolutely know for sure, that you have to understand your intent as a researcher. We focus on goals and objectives in research. All of our applications, I mean, everything that we're doing in terms of writing proposals focuses on the goals and objectives of your research. For me, it is more important to understand what my intent is. So if my intent or my goal is to understand the experiences that Black women are having in terms of accessing HIV services, that's fantastic. If my intent is to guarantee the survival and well-being of Black people, that has a deeper meaning. And I think researchers always have to figure out what is your deeper meaning of working with a particular population. So what is your intent? Communities want to know what your intent is. They don't necessarily want to know about the goals and objectives of your research, that's for you. That's for you in the academic space that you're in. Communities want to know, who are you? Who who are you, in a way that we can trust that your intent is one of well-meaning for us as a community, and particularly Black communities, who have been often marginalized in the research space. So intent for me is the most important part of understanding why we do what we do. You have to also hold yourself accountable to the community that you are studying. The only way you will know that you are doing good work for a community is if they tell you you're doing good work for that community. Right? The only way I know I am providing good service to the Black community is if they tell me that I'm doing a good job. Holding yourself accountable means that you allow that community to critique your work. You actually actively seek um, input from that community about your work, not just about your research, about you and your work. And I think sometimes that's a hard place to put ourselves in. And I've found myself in that position many times over the years, where sometimes it's hard to hear the critique from community about what you're doing and how you're doing it. But accountability means that you have to leave yourself open for that critique and advice. People don't critique you because they necessarily want you to fail. People usually, and people who are good spirited anyway, are critiquing you so you do better. And so I try to keep myself open to that. Understanding that taking from the community requires giving back, and often giving back more than you take, because sometimes we have a false sense of um, you know, just gathering these interviews or just getting this information from a community is not much, right? Is not taking much from them. But you do have to understand the magnitude of what we expect from research participants and from communities. And so you also have to be replenishing that community. You have to be giving back as much as you're taking, or even more. And that understanding tangible benefits for research participants and communities may not be what you think. Sometimes we think the $20 or the $30 that we're giving as compensation is sufficient. You also have to get that feedback from communities in terms of what are tangible benefits for them to participate in studies. And sometimes that's challenging when we're working with research bodies and funders who don't understand some of the requests that we make in terms of compensation, or the way that we engage community that is outside of the norm, outside of the traditional Western models of what benefits look like. Even from an ethics perspective, sometimes I find myself fighting with ethics boards in terms of what they deem to be tangible benefits versus what I know the community needs and requires. Um, Something else, especially for some of our learners on the call today, when you're thinking about your research methodology, when you're choosing your research methodology, right, the methods that you use, right, we tend, I'm trained in a Western model, so I tend to use Western frameworks. And the three that I work with are community-based participatory research, interpretive phenomenology. My PhD is out of OISE, coming out of the former sociology and equity studies. And so I am a phenomenologist in the sociological perspective. And mixed methods is something that I use. But I also understand why I use these three methods. And I use them when I'm trying to do particular things with communities. So community-based participatory research for me is the empowerment model. When I'm working with communities and the focus is around the empowerment or the development of skills or the advancement or transformation of a particular community. So I use that method to engage Black communities meaningfully, to co-theorize and co-design research for social change. So when I'm trying to develop new methods or new ways of answering a particular question, right, CBPR is used for me when I'm really deeply engaged with community and co-designing something with and for a community. When I'm trying to understand anti-Black racism, which is a lot of the work that I do, to understand how it actually manifests and how it impacts Black communities and their health. That's when I'm using interpretive phenomenology to understand the lived experiences of Black people in relationship to healthcare and healthcare access. What I'm really trying to understand is how do we as Black people orient ourselves within a very disorienting system of anti-Black racism, right? So how do we stand up straight in a system that is actually in opposition to us standing up straight? So a lot of my understanding around that is very important, and my research is asking those questions. But advocacy for me is when I'm really trying to push policy, I'm trying to change policy, I'm trying to change how we deliver services. I'm not just trying to identify what the problem is. And this is where you'll see me work in mixed methods or working very closely with epidemiologists. I always say the epi folks are my friends. They always have to be my friends. I'm a qualitative researcher. But race-based data collection in healthcare is really required to understand Black community health disparities and advocate for equitable health resources and improved health outcomes. So I need both the quantitative and the qualitative data. I find when I'm trying to do that kind of advocacy with ministries or even trying to engage Black community to understand the magnitude of some of the disparities that we're experiencing in healthcare, the numbers are what motivate people, right? The numbers are what absolutely bring the awe and the shock and all of those things forward. And so mixed methods then becomes a really, really important tool for advocacy within the community. So my advice is always think about your methodology, but why are you using it and what are you going to do with that methodology? How is it going to move, right, your agenda forward, right, your intent forward? I also, again, I said this already, right? Research for me is not for the sake of doing research. Research for me is an intervention strategy. When I'm looking at our data in terms of the ACB community and HIV, it's no longer, I think, useful for us to just be able to identify the disparity, right? We have to think about what we're going to do to change that disparity, right? It has to be a directive. So understanding our intent to end the impact of anti-Black racism in our health outcomes, for me, is the underlying pretext of research as an intervention strategy. There's four things that I think about when I think about my research being used as an intervention strategy for addressing HIV. Black community members must direct the building of foundational research for their own communities. We have, as I said, because of the limited number of us in academic spaces, the limited number of us being able to even hold research grants, the limited number of us that are even able to be PIs on research, we have relied heavily on our allies in the system, Dr. Lippi being primary case example, and I think an exemplary example of what an ally means in terms of doing this work. But now we have to start thinking about how do we push Black community members forward to build their own foundational research agenda. We have to facilitate the creation of equitable partnerships with communities and academic institutions. If you're working with marginalized communities and then expecting them to engage in an academic institution, right, the power differential is dramatic. And so we have to think about how do we create more equitable relationships. This hub model, for example, is one of those very complex ways of creating equitable relationships. But I think we all have to be very attuned to it at all times. It's really important that communities develop their own analysis framework. So how do they analyze data? Having racialized folks on research teams is important, but that doesn't necessarily drive the analysis framework to lean towards the methodology that that community may have chosen for itself. So it's really important to understand the importance of why we want to develop our own analysis frameworks and what those look like and how those can be implemented, regardless of whether you identify with that population or not. And the translation of research into political action. So when I particularly am working with Black communities, I don't have the luxury of not engaging in political action, that my research has to drive change. Um, and that I'm always thinking about my research. If I'm thinking about access to healthcare, then what other types of programs can my research facilitate developing? Um, if I'm thinking about uh, the impact of racism on individuals, then I have to look at what kinds of methodologies or models will I end with that can help alleviate the stress of anti-Black racism on individuals. So you're always thinking about the translation of research into political action. Researchers who hold themselves accountable to Black communities, immerse themselves in understanding systemic anti-Black racism, and commit themselves to the survival and well-being of Black people will be the most successful in their work with and for Black communities. You can replace Black community with any marginalized or equity-seeking group in this formula. Accountability has to be number one. Two, deeply understanding what systemic racism or systemic discrimination looks like for that community in the Canadian context, in the academic context, in the research context, and even within yourself, right? So understanding how you might be implicated in engaging in systemic discrimination. Right? So really understanding it, because you can't eliminate something you don't understand deeply. And then your commitment to the survival and well-being of the population that you're focused on. Understanding what their experience is one thing. Committing to their survival and well-being is something different, right? And that goes back to that intent piece. What is my intent when I'm conducting research? Last slide. In the context that I have worked in for over 30 years in Canada, there's one pattern that is very static. There is no place where Black people are thriving in our full identities that we have not fought for and created for ourselves. That is some heavy lifting work that a community has to engage in when the spaces that support them are the spaces that they've had to create, that they've had to fight for. So one of the things that we have to think about as researchers doing this work is how do we get out of that cycle of there's a disparity, nothing happens until Black people push for the change, and then we kick in. What we want research to do is kick in before, right? That I don't have to actually be the one to raise the alarm. I don't have to be the one that's pushing for that change. I don't have to be that sole Black researcher on a team that is asking for something to be different for the community. That we get out of that system of waiting for the marginalized to be the ones to push for the change. That we're all actively working together for the changes that we require in our system. So I'm going to stop there. Those are some of the big ticket items um, that I wanted to share with you. And we can just have a conversation now about maybe what some of the challenges you are experiencing, or does any of this resonate with anybody on the call today?